I want to ask you something personal, and I want you to think about it honestly before you answer. When you look in the mirror in the morning, before the day has started and before you have done anything to prepare for it, do you recognize the person looking back at you? Not in the deep philosophical sense, I mean physically. Does your skin feel like it belongs to you the way it did 10 or 15 years ago? Does it hold its shape the way it once did? Or has something shifted, quietly and gradually, in a way you noticed but never quite understood? Most people over 60 attribute what they see entirely to the passage of time. The thinning skin, the deepening lines, the dryness that no cream seems to fully address, the joints that feel stiff before the body has had a chance to warm up in the morning. They accept it as inevitable. They adjust. They spend money on topical products that promise things the skin cannot deliver from the outside. But here is what I have learned in 25 years of working with older adults. Much of what we attribute to aging is actually the result of a specific internal process that most people are making worse without realizing it. And one of the ways they are making it worse is through something they do every single day, multiple times a day, while believing they are doing something healthy. The way they drink water. Stay with me, because by the end of this conversation you will understand something about your body's collagen system and its relationship to hydration that most seniors have never been told. And you will know one simple, inexpensive daily change that may do more for your skin, your joints, and how you feel in your body than anything else you have tried. My name is Dr. Williams James. I have been practicing medicine for 25 years, with a significant focus on healthy aging and the specific physiological changes that occur in the body after 60. I am not going to tell you that aging is something you can reverse, or that there is a miracle solution hiding in your kitchen. What I am going to tell you is that the biology of aging skin and joint health is better understood than most people realize, and that there are specific, evidence-supported daily habits that work with your body's existing repair systems rather than ignoring them. This conversation is about one of the simplest and most accessible of those habits, and it starts with understanding what is actually happening inside your body right now. Here is the biological reality that most health conversations about aging skin never quite explain clearly enough. Collagen is the most abundant protein in the human body. It is the structural framework that keeps skin firm, smooth, and elastic. It cushions and supports joints. It maintains the integrity of bones, tendons, ligaments, and the gut lining. Every system that gives you physical resilience, flexibility, and a youthful appearance depends on adequate collagen. And here is the problem. After the age of 40, the body's collagen production begins declining at a rate of approximately 1 to 2% per year. By 60, many adults have lost 20 to 30% of the collagen production capacity they had in their 30s. By 70, that loss is even more significant. The visible consequences are familiar. Skin loses its plumpness and develops the crepey, thinning quality that becomes increasingly difficult to address with topical products. Joints lose some of the cushioning that made movement fluid and pain-free. The connective tissue throughout the body becomes less resilient. Research published in the journal Dermatoendocrinology has confirmed that intrinsic aging, the biological aging of the skin driven by internal processes rather than external damage, is primarily a collagen story. The deepening of wrinkles, the loss of skin volume, the reduction in elasticity that is characteristic of aging skin in both men and women are all directly attributable to declining collagen synthesis and accelerated collagen breakdown. But here is what most people are not told. Collagen production is not simply a function of age. It is a function of available building blocks, enzymatic activity, and the internal environment in which those processes occur. And that internal environment is significantly influenced by daily habits, including the most fundamental daily habit of all, how you hydrate. Let me explain what happens to hydration and nutrient absorption after 60, because this is the part that changes how you think about your daily glass of water. In a younger body, the digestive system is a highly efficient processing facility. Stomach acid is abundant and activates the enzymes needed to break down proteins, including the amino acid precursors of collagen, into forms the body can absorb and use. Mineral absorption is robust. Cellular hydration. the process by which water actually enters cells and tissues rather than simply passing through the digestive system, is supported by a healthy balance of electrolytes and signaling molecules. After 60, several of those processes become less efficient simultaneously. Stomach acid production, which peaks in the 20s and 30s, declines significantly with age. Research published in gastroenterology literature has found that a meaningful percentage of adults over 60 produce insufficient stomach acid for optimal digestion, a condition called hypochlorhydria. When stomach acid is low, the activation of digestive enzymes is impaired. Protein digestion becomes less complete. Mineral absorption, particularly of calcium, magnesium, iron, and zinc, all of which are involved in collagen synthesis and skin health, becomes less efficient. Think of your body's collagen production system like a construction project. Collagen is the building material being produced. The amino acids from dietary protein are the raw materials. The enzymes are the construction crew. And the internal environment, the balance of acidity, hydration, and signaling molecules, is the site conditions that determine whether the crew can work efficiently. After 60, the site conditions have deteriorated. The construction crew is working with less power. The raw materials are arriving in smaller quantities because absorption has declined. And the building project, the ongoing synthesis and repair of collagen throughout the body, is falling behind. Plain water delivered into this system does a foundational job. It maintains blood volume. It prevents the blood thickening that comes with dehydration. It supports kidney function. These things matter and should not be minimized. But plain water does not improve the site conditions. It does not activate digestive enzymes. It does not enhance mineral absorption. It does not signal the collagen synthesis pathway to upregulate production. It delivers hydration without the additional signals the aging body needs to use that hydration effectively for deep cellular repair. The one addition to your daily water that changes this equation is something you almost certainly already have in your kitchen: fresh lemon juice. Before you decide this sounds too simple to be meaningful, stay with me through the mechanism. Because what lemon juice does inside the aging body is genuinely worth understanding. The first and most direct way fresh lemon juice supports collagen production is through vitamin C. Vitamin C is not optional for collagen synthesis. It is biochemically essential. The enzymes that convert pro-collagen into mature collagen fibers, specifically prolyl hydroxylase and lysyl hydroxylase, require vitamin C as a cofactor to function. Without adequate vitamin C, these enzymes cannot complete the molecular cross-linking that gives collagen its structural strength. The result is collagen that is malformed, less stable, and more susceptible to breakdown. Research published in the American Journal of Clinical Nutrition has established that older adults have measurably lower circulating vitamin C levels than younger adults, even when dietary intake appears adequate. The reason is multifactorial. Oxidative stress, which increases with age, consumes vitamin C rapidly. Reduced digestive efficiency means less is absorbed from food. A single fresh lemon provides approximately 30 to 40 milligrams of vitamin C in a bioavailable form, meaning the vitamin C is accompanied by the bioflavonoids and cofactors that research suggests enhance its absorption and tissue retention compared to isolated supplemental vitamin C. For an aging body operating with reduced digestive efficiency, this matters. The second mechanism is digestive activation. Lemon juice is acidic, with a pH of approximately 2 to 3. When warm lemon water is consumed on an empty stomach, the acidity gently stimulates gastric acid production and activates the digestive enzyme cascade that is consistently underactive in older adults. This improved digestive activation does not just benefit the lemon water itself. It improves the body's capacity to extract and absorb the protein, minerals, and nutrients from everything else consumed during the day. The third mechanism involves mineral absorption. Lemon juice contains citric acid, which forms soluble complexes with minerals including calcium, magnesium, and zinc in the digestive tract. These soluble complexes are more readily absorbed across the intestinal lining than the less soluble forms in which these minerals often exist in food. For older adults whose mineral absorption is already compromised, this chelating effect of citric acid can meaningfully improve the availability of minerals that are directly involved in collagen synthesis and skin cell health. The fourth mechanism is anti-inflammatory. Chronic low-grade inflammation, which researchers now call inflammaging, accelerates collagen breakdown through the activation of enzymes called matrix metalloproteinases that degrade the collagen matrix in skin and connective tissue. The flavonoids in fresh lemon juice, particularly hesperidin and eriocitrin, have documented anti-inflammatory properties that help suppress the inflammatory signaling responsible for this accelerated breakdown. When the inflammatory environment is calmed, collagen degrades more slowly, and the net collagen balance, production versus breakdown, improves. Now let me be precise about something important. Lemon juice does not make the body acidic. This is a common concern and a common misconception. Lemon juice is acidic before it is metabolized. After metabolism, its net effect on the body's internal pH is alkaline rather than acidic, because the citrate it contains is metabolized in ways that consume acid. The acidity that matters for the digestive activation mechanism operates in the stomach, where acid is beneficial. The systemic effect on tissue pH is neutral to mildly alkaline, which is conducive to healthy cellular function. Let me tell you about a patient I will call Miriam. She was 72 years old, a retired librarian who came to see me not for any acute medical complaint, but for what she described as a general decline in how she felt in her own body. Her words stay with me. She said, "I feel like I am disappearing into myself and I cannot find the right person to tell me why." What she meant was specific when she elaborated. Her skin had changed dramatically over the previous 3 years in ways that felt accelerated rather than gradual. It was thin in a way that bruised easily, dry in a way that no moisturizer seemed to address for more than a few hours. The lines around her mouth and eyes had deepened to a degree that felt out of proportion to her age. Her joints, particularly her knees and her fingers, had become stiff in the mornings in ways that were affecting her ability to do things she loved. And despite drinking what she considered an adequate amount of water throughout every day, she consistently felt as though the water was not reaching her somehow. Her skin remained dry. Her energy remained low. Her joints did not improve. Miriam's blood work revealed several findings consistent with her symptoms. Her vitamin C levels were at the low end of the normal range. Her zinc and magnesium levels were suboptimal. Her inflammatory markers were mildly elevated. And when I asked about her morning routine, she described waking up and immediately reaching for cold water from the refrigerator, which she consumed quickly before starting her day. Nothing about that morning routine was wrong, in the way that anything obvious is wrong. It was simply insufficient for what her aging body needed from the start of the day. It was not activating. It was not signaling. It was maintenance without restoration. We made one foundational change together. Every morning, before coffee, before breakfast, before anything else, Miriam would prepare 1 cup of warm water, not hot enough to burn but comfortably warm, and squeeze half a fresh lemon into it. She would drink it slowly, over 5 to 10 minutes, sitting quietly before the day began. We did not change her diet dramatically. We did not add an extensive supplement protocol. We did not modify her medications. We added one deliberate morning habit and asked her to maintain it consistently for 60 days. At her 8-week follow-up, Miriam described improvements that were specific enough to be clinically credible. Her morning joint stiffness had reduced noticeably, particularly in her fingers. She felt that her skin, while not transformed, had developed a quality of hydration that felt more sustained than before. Her digestion was more regular and less bloated. And she reported something that she found difficult to articulate, but that I hear frequently from patients who address their hydration properly. She said, "I just feel like things are working better in there." Her follow-up blood work showed her vitamin C levels had risen meaningfully into the optimal range. Her inflammatory markers had reduced slightly. Small changes, not dramatic, but consistent with the mechanism and consistent with what she was experiencing subjectively. Miriam told me at that appointment something I want you to hear. She said, "I spent 3 years and a significant amount of money on products to put on my skin. Here is the practical protocol I want you to take from this conversation. Before coffee, before breakfast, before anything else, Prepare 1 cup of warm water, not boiling, comfortably warm, the temperature you might drink herbal tea. Squeeze the juice of half a fresh lemon directly into it. Drink it slowly over 5 to 10 minutes. That is the entirety of the morning protocol. Simple, inexpensive, and sustainable. There are several things that matter about how you do this. Use fresh lemons, not bottled lemon juice. Bottled lemon juice is processed and pasteurized in ways that degrade the active bioflavonoids and reduce the vitamin C content significantly. The compounds that make fresh lemon juice valuable for the mechanisms described are not preserved adequately in commercial bottled products. Use warm water rather than cold. Cold water constricts the digestive tract and slows the gastric activation process. Warm water supports the gentle digestive stimulation that is the foundation of this habit's benefit for older adults. Do not add sugar or artificial sweeteners. Sugar directly accelerates collagen breakdown by a process called glycation, where sugar molecules attach to collagen fibers and make them stiff and fragile. Adding sugar to your morning lemon water undermines the primary reason you are drinking it. Drink it slowly rather than consuming it quickly. The benefit comes partly from the sustained low-level digestive stimulation that slow consumption produces. Drinking it quickly reduces the signaling effect. Rinse your mouth with plain water after finishing. Lemon juice, like all acidic beverages, has potential to affect tooth enamel with prolonged, direct contact. A simple mouth rinse with plain water after drinking eliminates this concern. If you have existing dental sensitivity, using a straw keeps the juice away from your teeth during drinking. If you have a history of acid reflux or gastric ulcers, start with 1/4 of a lemon rather than a half, and assess your tolerance over 1 to 2 weeks before increasing. For the vast majority of older adults, warm lemon water on an empty stomach is well tolerated and often improves rather than worsens reflux symptoms over time because of its effect on digestive regulation. But individual tolerance varies and should always be respected. Maintain this habit for a minimum of 30 days before evaluating results. Collagen synthesis and skin cell renewal operate on biological timelines measured in weeks, not days. The improvement in joint comfort and digestion is often noticed within the first 2 weeks. The improvement in skin quality and hydration typically becomes apparent between 3 and 6 weeks of consistent daily practice. This habit supports collagen production. It does not replace adequate dietary protein, which the body requires as the raw material for collagen synthesis. Ensure your daily diet includes sufficient protein from eggs, fish, legumes, dairy, or meat to give the collagen production pathway the amino acids it needs, alongside the enzymatic support that the lemon water provides. I want to say something to you directly before we close this conversation. The changes that aging brings to the way you look and feel in your body are real. I am not going to minimize them or suggest that a glass of lemon water erases them. What I am saying, based on 25 years of clinical experience and the research that underpins the mechanisms we discussed today, is that much of the decline that older adults experience in their skin, their joints, and their sense of physical vitality is not as fixed and inevitable as most health conversations suggest. Your body still knows how to make collagen. It still knows how to repair skin. It still knows how to maintain the connective tissue that gives you flexibility and comfort. What it needs, more than it did at 35, is the right daily conditions to do that work. And creating those conditions does not require expensive interventions. It requires consistent, informed daily habits that work with your biology rather than ignoring it. 1 warm glass of lemon water every morning is not a magic solution. It is a foundation, a daily signal to a body that is still fully capable of responding to the right inputs if you give them to it consistently. Tell me in the comments whether you have ever tried lemon water regularly and what you noticed. And tell me what health topic you most want me to address next. I read every comment, and your responses genuinely shape what I bring to this channel. If this conversation gave you something useful, please share it with someone in your life who has been spending money on topical skin products without addressing what is happening internally. That share may redirect their attention and their resources towards something that actually works at the level where aging begins. Subscribe to this channel for more honest, research-grounded conversations about what your body genuinely needs after 60. Next time, we are covering the 5 nutritional deficiencies that are most consistently linked to accelerated skin aging in older adults, and the simple dietary adjustments that address each one. You will not want to miss that conversation. Everything shared in this video is general medical and nutritional information based on published research and clinical experience. It is not personal medical advice and is not a substitute for care from your own physician. Individual health situations vary significantly, particularly for older adults managing digestive conditions, kidney disease, dental concerns, or taking medications that may interact with dietary changes. Please consult your doctor or a qualified healthcare provider before making changes to your daily health routine, particularly if you have a history of acid reflux, ulcers, kidney stones, or any condition affecting the digestive tract. Your physician knows your complete health picture. Bring this information to that conversation. That is where safe and personalized decisions about your health begin.